Good morning and thank you for joining us. I'd like to start off with an update on our case numbers and the status of some of our cases, and also let you know that we're going to change very slightly how we're reporting some of this information out as we're getting more and more cases. So to date, we still have only 18 cases. And we have 663 tests that have come to Lane County, with the caveat, of course, that those numbers are probably much larger, a higher number than the 663. The part that we're going to change is that we're now going to report out on the number of individuals who have recovered, the number of individuals who are still in the hospital, who are sick at home, and then any deaths. And then we'll take some of the symptomatic information that we've been reporting out in a very detailed fashion and roll that into broader themes. And hopefully what that will allow us to do is show you kind of what we're seeing in our overall area and general themes rather than individual instances. So to date, we now are happy to announce that we have 4 individuals who have recovered. These individuals, we have 1 in their early 30s. That one was announced yesterday. We have 2 in their 50s, and we have 1 individual in their 60s. So we're very happy to announce that. And again, recovery is defined by 72 hours passing after the time that they no longer have a fever or a cough, and that is also without medication to facilitate that low fever and no cough. We still do have 5 individuals in the hospital. We also have 8 individuals who are sick at home and following all public health recommendations. And of course, we have 1 individual who unfortunately passed. The themes that we're still seeing, besides the typical COVID-19 symptoms that you've seen reported on broadly in the news around the nation, but what we're seeing here locally outside of those general themes are a headache. That seems to be a very common occurrence, especially early on. And we're not just talking about a mild headache, but what's been described as a splitting headache. GI symptoms seem to be resulting in a small percentage of our cases. That number right now, we're still trying to roll that out, but so far around 10% of our cases. And then fatigue is a very common symptom. Obviously, that's hard to define, especially during such stressful times. But the fatigue really needs to be unexplainable fatigue. So, if you've had a good night's sleep, but you're still feeling very lethargic and out of energy. And then again, loss of taste and smell in about half of our cases. And then what we're finding is that as we continue conversations with our cases, they are reporting after the fact that, oh yes, I didn't have a sense of taste and smell, and right now I still don't. So it seems to be extending to the duration of the illness. Another thing that we're going to be reporting out on is the duration of illness. Of course, this is something that we will have to look at in a very small number right now. It's only 4 individuals who have recovered, but the average seems to be around 3 weeks for the illness. And then that data will grow, and our ability to report out on that will grow as we see more and more individuals recovered. So the next thing I want to comment on is our modeling. Yesterday, we shared some modeling that our health officer had done with other health officers across the state, just to give us a better sense of potentially when we could expect a peak, what that peak would look like, and some different scenarios. So one thing you'll notice on a lot of the models that you see nationally, and certainly is true for our models, is the steepness of the curve. So what we're trying to do is to get a less steep curve. So instead of it looking like this, looking more like this. What that is really showing us is the number of cases and the duration of time that those cases are rolling in. If the curve is not very steep, then we're able to really meet that demand in terms of hospital capacity and our ability just overall as a health system to accommodate those cases. So when we're talking about flattening the curve, we're talking about slowing that rate. To date, we have not seen what we would classify as exponential growth. We're seeing 1, 2, maybe 3 cases happen within a pretty broad amount of time. And so what we're worried about is exponential growth. We want to see that really slow down, and that'll allow us to react to the outbreak better. In talking with the other public health officials and really kind of devising and understanding what's going to be important for us to be able to get through this, really that's one of the main considerations. Unfortunately, what that looks like for the people who are at home watching the outbreak happen is a longer duration of the outbreak. So instead of a very sharp peak that overwhelms our healthcare system and then falls off, you see a very gradual peak and then it maintains for a longer period of time. So you will still see cases come in. You will still see that happen over a longer period of time. However, our ability to react to the outbreak will be increased. So that's really what we're trying for. That extends the time of the peak, and that also extends the duration. On the national models, you see a much steeper curve than what we are going to probably see here in Lane County. We feel very fortunate that we're in the position that we are right now. I'd also like to give you a little bit of an insight into testing here locally. We've been talking a lot about testing, making it available here locally. There were some initial tests done at local facilities here. However, we've had to slow that down and stop for now because of shortages of supplies. Those supplies have been diverted to New York City. And so those are primarily in the reagent aspect or the chemicals needed to process the test. And so as we try to react as a nation, part of that is really making sure that certain areas that are experiencing exponential growth and their healthcare systems are being overwhelmed receive the proper care and the proper supplies that they need. So we're still working on the testing piece while trying to make and be a good partner nationally for those areas. We have looked into the Abbott Rabbit testing model, and we are in line to potentially order one when that ordering process becomes available. However, we don't have a date on when those order forms will be available or when the company will actually make that available. So we've seen some time figures as early as next week, but really we're dependent on that company and the information that they're sharing. So just so you know that we are actively pursuing that as an option for our community. Now, bear in mind that doesn't mean that Lane County Public Health or Lane County as a governmental entity is going to buy a lot of these machines and make them available. Generally, this will probably be rolled out at a point of care level. So really doctors' offices, hospitals, and other care settings. And we will help facilitate that and make that available and really be part of the process. But we want to set the expectation that what public health's position right here is to help the whole community, the overall effort, really fall in line and move together. Next, I'd like to show you a graph on testing. So this is black and white and very small. I apologize for both of those considerations. I went ahead and took a Sharpie and just outlined the curve so you could hopefully see it a little bit better. But what you see is going back to the 16th of March on our testing numbers here locally, coming from Lane County. And you can see those low numbers. This caused a lot of confusion, and people were pretty upset in our community. Why do we have such low numbers? And then you see private testing come on board right around in this time frame. So this is about 4 or 5 days after that March 16th date. And now you're seeing the sharp increase. So as I mentioned earlier, we're at 663 that we know about. We're probably over 700. But that increase is exactly what we want to see. This is the number of tests that will help us have more robust information that will give you the ability to know what is happening and give public health the ability to react appropriately, make the proper recommendations, and consolidate our community effort. Next, I'd like to talk about our PPE efforts. So to date, the county has collected and distributed upwards of 600 swabs to local providers, primarily in the hospital setting, upwards of 15,000 procedural masks. So those are those surgical masks, not the N95 masks. 20,000 pairs of gloves to local providers. 150 gowns, and at least 200 N95s. So the low number on the N95s really has to do with some changing guidance on N95s, how they're used, and what settings they're used. So the good news is we do have a supply of N95, and we will continue to make those available as they're needed by our provider community and our medical systems. Finally, I'd like to comment on the fact that today is National Census Day. Everyone is encouraged to complete the census. You should have received within the last couple of weeks a PIN number from the U.S. Census Bureau. You can use that number to access the census website at census.gov. And it takes about 10 minutes to fill out the census information, and then you will be on your way to being done with that. And that really helps our ability to come out of even this crisis, that when we're through this, that we still have performed the most basic but necessary functions that allow us as a government to provide for the many people here in the U.S. So please take the time to fill out that census form online, and today is the day to do so. At this time, I will take any questions from members of our media.
Question from Michael at KZI. How is Lane County Public Health still handling the normal workload, and are we practicing telemedicine?
So the question from Michael at KZI is, how is Lane County Public Health handling the normal workload, and are we practicing telemedicine? So I'll divide that up a little bit. How are we handling the normal workload? And so actually, just yesterday, I was down with some of our communicable disease investigators, the people who are talking to COVID cases, and we have other people talking about other communicable diseases that are still happening in our communities. So that work is ongoing. What has taken a backseat or has paused for the time being is some policy work on some longer-term issues. Some of our tobacco prevention and some of the other things are still being worked out, but perhaps at a lower level, simply to be able to react at a more concerted level for COVID. And then I'll move on to your telemedicine question. So that is actually outside of public health. That would be with our community health centers of Lane County function, so the clinics that we run throughout the county. And in terms of telemedicine with those clinics, we have moved to limited telemedicine where it's available. Also doing teleconferencing, so talking to our patients on the phone and being able to triage individuals via that method. And we are still seeing patients on a limited basis, taking all the proper precautions necessary to ensure everyone's safety.
So, follow-up question from Michael. Can you talk more about the rapid testing, not rabbit, because I believe some people heard it.
Yes, so the question from Michael is, can you follow up on the rapid, now I'm making a mistake, rapid with a D testing, and I apologize, I do tend to mumble. Yes, the rapid test is really a technology that has yet to be utilized. It is something that came out of a company from California who designed a way and a machine to be able to process a test in about 5 minutes to receive a positive and about 15 minutes to receive a negative test. This is designed for a point of contact or a care setting. So what it would look like is a small machine. I've seen them. They're about the size of a printer. They would be located in a doctor's office. And then instead of receiving large amounts of the raw materials of chemicals necessary to process the test, it would actually come in a pre-packaged, smaller fashion. And so that would allow a smaller machine to do a limited number of tests for a limited number of individuals who are coming into that doctor's office, but process them faster. So it definitely expands our testing capacity, not to the tune of thousands or tens of thousands of individuals, but it allows for those interactions to happen at the doctor's office and then save some of those tests from coming to our bigger labs who are able to process those batch testing. So it is a promising technology. It is something that I think would be of great use to public health to be able to map disease throughout the area, in addition to some of the syndromic surveillance that we're pursuing, looking at the level of symptoms that are happening. So not individuals who are necessarily testing positive for COVID, but all those people who are saying, listen, I was told to stay home, but I can't be tested, but I obviously have symptoms. We care about those people, and we care about the information that they can provide. And so what we're focused on right now is looking at how we can map those individuals on a broader scale, obviously preserving privacy, but looking at how COVID is moving throughout our community and where hotspots might be.
Question from Tatiana at the RG. I will summarize, but she's wondering about the building the board approved the purchase of yesterday, how we will use it in response to COVID-19 and what it might be used for after.
So the building, the question is from Tatiana, the registered guard, and she's just wondering wanting to know more details about the building that was approved for purchase yesterday by our Board of County Commissioners. And first off, we're thankful for their leadership on this effort. The initial use of that building, as I understand it, is going to be for that function of being able to provide a space for our unhoused community. We have agreements in place for individuals who are unhoused if they have symptoms of COVID or need to be isolated. We have some of those agreements in place. However, they are not at the level that we need them to be. And so the building would really allow us to have significant space to be able to provide isolation and the same level of care for those unhoused individuals that we have been able to afford through other resources in our community to the entire community. So really that's the primary function. Our Board of County Commissioner Chair, Heather Buck, will be available this Friday. We're trying to get our elected officials in here at least once a week to speak to the community and to the public via these press briefings. And so she can really elaborate on that and talk in more detail about those plans. But right now, the initial use is for those individuals who need to be isolated, who are unhoused.
Would these new tests change the criteria for who is tested and allow more people to be tested? From Rachel at KLCC. So
the question is from Rachel at KLCC, and I believe she's referring to the Abbott test, these rapid tests. Again, rapid, not bit. These rapid tests would, and her question is whether or not they would change the testing requirements, change the testing landscape, and how many people are able to be tested. And so the answer is yes. In broad terms, it would significantly change our ability to test individuals and probably the criteria for which individuals are tested. However, what it doesn't change is the overall shortage of the chemicals necessary to test. So what it allows us to do is be more efficient on those chemicals use. And so you're doing it on a case-by-case basis, one for one, and so providers can really make that decision, perform the test, and then deliver the results there in the care setting. But it's important to remember that what we're talking about is for one patient, 5 minutes of testing. We have 375,000 people in Lane County, so like I said before, this is not going to mean thousands more tested or tens of thousands more tested, but it will potentially be tens or hundreds of more people tested, and it will mean a significant difference in the care of those individuals and public health's ability to really track data and understand how the virus is moving throughout our community.
Michael from KEZI, tell us more about sending those testing supplies to New York.
So Michael from KZI asked, tell us more about sending those testing supplies to New York. So really Lane County is out of that decision-making process. So those decisions are largely being made at the federal level and at the state level on where these resources are diverted to. And so we put in requests like every other county in Oregon and every other county across the United States, and then the prioritization is coming from those higher levels. So we were notified about that and certainly continue to advocate for resources, but understanding that we do need to be good partners for the overall national effort. So fortunately, we are still in a spot, Lane County-wise, where our medical systems are not being overrun, and we are still at a manageable rate of infection, and so we can absorb a slowdown in some of these areas. So that is what we know right now, and certainly we will share more if we learn more.
Brian at KZI would like to know what is the county doing to address the growing mental health toll of the pandemic.
Brian from KZI would like to know what is the county doing to address the overall mental health aspect of the outbreak. So certainly we are tracking various mental health indicators to try to come up with some real data on that subject, because what we don't want to be doing is making assumptions. And so there are limited ways in which we can start to track that. I can't comment about that just now because I don't have the information in front of me. However, that has been a top priority for us from the onset, and we have made mental health resources available through our call center, and then also resources in the community. We've identified which resources are able to still be utilized with social distancing and through over-the-phone help. And so we have those on our website. If you go to lanecountyor.gov/coronavirus, there is a behavioral health component where we've compiled all the different mental health resources that are available via phone, the free resources, and really trying to connect people with those. Additionally, in our patient population, that has been something that we address on every single patient interaction is how are you doing? What is your stress level? What can we talk about to help you feel more secure and more prepared for what's to come? And certainly, I think it's happening at the emergency effort as well. From the very get-go, our incident commanders, the people that are sort of at the helm of the incident, have been talking about the importance of making sure that we are taking care of our mental health and that we're promoting that in the community as well. So there's a lot going on, and I'm happy to share more resources as I find out about them. And that's all we have for today. Thank you for joining us.